those of you who do, the inion is right underneath the plate in your head. Then the screws. I have one. We all have one, right? I think. Yeah. So it's like your graduation gift. But right underneath this plate, if you guys feel in the back of your head, just go like kind of right from the middle and straight down before you really get to your cervical spine. There's a little tiny, it's just a little bump. Kind of sticks out more than the rest. All right, and if it hurts, it's probably a zit. Don't squeeze it. It just poke around and find it, and it's probably there. I don't know. I'm feeling like I have to get back in my groove again. So then from there you're going to go from the bump or the inion. They call it the bump of knowledge. So I don't know if size matters. If it's bigger, you're smarter. If it's smaller, you're not. I don't know if it corresponds to any other parts of your body. And, oh, you are old. You're all panning this. I should have looked when I saw Anne. I was right. So from the inion or that bump of knowledge, if you're gonna go to either side and you're gonna go to the mastoid processes, and you can feel them on yourself. Go from that bump and just go along that line, and you should be able to feel it's a protuberance, and it's actually once you're on it, once you get on it, it's actually very sore. If you go too far forward, you're going to be in TMJ, so don't go that far forward, but just go a little bit. You'll feel it behind the ear, and it's actually a little uncomfortable when you get on it. Okay, so that's what you're seeing right here. Ta-da. One on the opposite side, and you can feel them more prominently. Upper trapezius, you're going to be able to feel from the upper part of your cervical spine down from the inion, up here, the little bump, all the way down to T12. So that's going to be. You basically have to know where the trapezius goes, upper, middle, and lower. And during your practical, yes, we will ask you the different fibers.
Just come to your cameraman.
Thank you. So from the inion down, if you guys were feeling stress on Tuesday, that's probably where you were feeling it all through your traps, through your upper traps, middle and lower traps. So we're going to get a better idea once we start muscle testing and specifically pull out each of the muscle groups, each of the segments of that muscle. But know that they go down and then they fan out across your back. C6 is that we go up here. It's easily to go 1, 2, 3, 4, 5, 6. So 6 is basically what you're going to feel is it's going to be at the level of the first cricoid ring, which I'm not going to. That's just kind of a landmark. But what's going to happen is you're going to feel the largest. If you guys flex your neck down, and you can feel the largest. We should probably do C7 first and then C6 so you can get a landmark. But C7 is going to be that larger bump on the back of your neck. The largest, that's the C7 spinous process. If you go just up there, up one, your finger like up to the next spinous process, that's C6. Right? So the largest bump, some of you may have a C, some of your C6 may also be kind of large, but usually C7 is the largest one. So flex your neck down, you should be able to feel C7 and go up one segment, and then you should feel C6. And obviously you go down one more, and it's a little bit, kind of sticks out a little bit further. But it's not quite as prominent as T1. So it's just, I think it's just a little bit easier to show you guys on here better than. Then we're going to ask you to palpate your spinous processes throughout 2, 3, 4, 5, 6, 7. 6 is here, 7, and T1. Then we're going to ask you to go down and palpate the rest of the spinous processes along the spine. Okay? And we're going to have a few different landmarks for you to determine the more prominent ones or ones that are going to be more relevant for you during this class in terms of bony landmarks. And other, and other structures, why we may want you to know certain ones. But of course, when you're treating, when you're in the clinic, it is going to be relevant that you're able to palpate and differentiate more or less between T1, T2, T3. And Joel, you can jump in at any time too, because Joel has a vast amount of orthopedic experience.
And guys, when you're doing your cervical palpation too, when you're feeling for C7. Like she said, a lot of people it's going to be blatantly obvious, and there's going to be a few of you where C6 and C7 feel almost exactly the same. So if you have someone extend, C7 won't go away. It'll stay there. Whereas C6 you'll feel kind of, dip away, like follow your finger forward almost into the soft tissue of the neck. So if you extend and it stays in the same spot, that's really going to be C7. It's pretty much a staple. It's not going to go anywhere. For C6, you won't feel as much. So that's another way to help differentiate. But otherwise, it's pretty obvious on most.
Next, transverse processes, and those are those structures that you're going to go from the spinous process, and they go about an inch or so from the spinous process. I have a pretty good picture just to show you structurally. Give me this one. Thanks. I'm just going to show you on here. That would be document camera. Oh, it's okay. See that? Okay. So you guys should be able to see that. I wanted that to come on. All right. So just so you can see, when you're looking at a vertebral body, you can see exactly what you're looking at. We were talking about a spinous process from here. I should probably just put the elbow in point, a lot easier. The spinous process from there, and then we said if you go out laterally to either side, there's where your spinous process is going. I mean, your transverse process. So you'll go out about an inch or so, and then you'll feel the next thing that kind of protrudes is going to be your transverse processes. Okay? Questions so far? Still good? Okay. We'll go back to it. Okay. This is for PSIS. I think we go through this every year, but I think we've nailed it down. In your book, it says PSIS. If we look at that as a landmark for S2, so PSIS corresponds with S2, with their sacral level 2. I know we kind of, every year we have this conversation,
Yeah,
but I think I wrote it down.
A lot of resource texts are different, you know what I mean, depending on where you are. You should be able to try and palpate the spinous processes. You should feel L5, L5 ends. The next level you really feel is S2, and then as you move out laterally, you should be on usually the inferior portion of your PSIS. But when we ask you to find PSIS, we always want the most prominent. So that's why there's always a little bit different, because some books will say between PSIS is this, but they're talking about they're on the superior part of the PSIS. And other books on the inferior part, and other books in the center, and they never specify where they are. So that's why there's always a little bit of wiggle room.
That's kind of, I think, what we've evolved to over the years is just to say that for the sake of variability, and as Joel said, you are going to have some different sources of reference, but for variability, we're just trying to nail it down where your PSIS is going to correspond roughly to S2. And of course, there are anatomical variations. L5, we came up with L5. L4, L5 is the disc space. We have the disc space of L4 and L5. So the space between L4 and L5 where the disc is at the top of the iliac crest. Okay, so if you use the top of the iliac crest as your guide, you're at the disc space. You're at the space between L4 and L5. Go a little superior, and you're at L4. A little inferior, you go and you're at L5. Okay, that's where we came with. The area of the SI joint. Again, we're going to be using PSIS more as our landmark for the sacroiliac joint, the SI joint, and we're going to be able to just we're going to slide off of the PSIS into those little dips and find our SI joint. All right, for people, if you've ever had your SI joint out, if you've woken up one morning and you look like this, or your pelvis has been rotated, you definitely know where your SI joint is. And people that have pain will tell you they know after a recurrent episode where they get that little subluxation or that little shift where it just makes them so uncomfortable, they're going to be able to tell you exactly it's my SI joint that's feeling out. It feels a little bit out. It's very uncomfortable. But if you've ever had that kind of pain, you definitely localize your SI joint. Sacrum, again, if you're going to use landmarks, you can use your PSIS and just know that you're coming in at the level of S2, that you're on the sacrum, and you go slightly anterior and superior, you'll be able to get in, you'll be able to palpate a little higher, and you go more distally and inferior, and you will be on the latter end of the spine, the more distal end of the sacrum. Ischial tuberosities, you guys have met before, right through our hip, okay, so your ITs are going up and in there, and paraspinal muscles, which you will know that every little tiny fiber, once you get out of Dr. Bigliotti's class, you'll know the teeniest little thread-like muscles to the largest, most bulky muscular structures. So that's basically palpation for the spine. What I do want to show you, because there is something that kind of gets us every. Can you do that from the camera?
Sure.
Thank you. I just want to show you. This is another one. This is when we because we're always like external auditory meatus or external acoustic meatus. Like it's that little bump. It's just the ear canal. So when we do goniometry, it's actually the ear canal. Every reference I looked at, it's not like a little bump. There's like an internal acoustic meatus, which is way inside your ear. But for the sake of measuring when we do goniometry, the axis of rotation is your ear canal. Your ear. If there's not a palpation for it, because if you can't put your finger in your ear, let us know, we'll help you. But that's going to be your axis of rotation for goniometry. I just really wanted to make sure, because sometimes there's, like, you have this little cute little bump over here, or you may have a cute little bump in the front of your ear. You know what? It's the ear canal. All right? And that's it. So I just wanted to clarify that, because that always comes up to, you know, is it down here or is it over here? Is it, you know, so I just wanted, it's your canal, your ear canal. So
The easiest one to find.
that's it. Boom. Done. All right. Any other questions? Do you guys have questions about that? Palpation should take you maybe 15, 20 minutes tops if you want to milk it. So why don't you take the time to do that on each other now? Please use